Hi, this is Dr. Clark Brittain of Bloomington, Indiana, representing my spa practice called Vibrant Life. Uh, if you get a chance to go to the web, go to www.drbrittain.com and you can get a little bit more information about who I am, what we do. I wanted to talk a little bit today about orgasmic dysfunction in women. Now, it's a little bit of a touchy subject perhaps, but it affects a lot of women. And in my discussions with my patients, I try to inject a little humor when I can, because this can be a really frustrating topic, because I see this as an issue that drives a wedge between a lot of couples, and it dissolves a lot of relationships because they can not have the type of intimacy that they want to have. And so there's some things that I do in my Vibrant Life practice that are geared towards helping that. So if you think about just in simplistic terms, guys kind of have an off-on switch, and women have some buttons and knobs and different arrangements. And anatomically, the guy has more of an external anatomy. Women have both a little bit of external anatomy and a little internal anatomy. So there's this kind of feminine mystique about what's really going on. So we see a lot of women who say, gee, I can't have an orgasm anymore, or they're not very satisfying, or maybe I have pain when I try to have intercourse. And so we try to sort out the various problems that are going on that are causing this. The most common thing that we see is a decline in hormones. And as I've shown in some of my other videos, I'm going to just highlight the reproductive hormone lifespan that most of us have. Childhood, puberty, reproductive years, perimenopause, menopause. Men, childhood, puberty, reproductive years, and then the slower decline of andropause, and then andropause is forever. So with that decline in hormone production, among the things that happens is a loss of vaginal mucus production, so there's dryness, elasticity, there's less sensation, diminished response of clitoral stimulation, there's a diminished response to stimulation of the G-spot, and it really does exist. There's sometimes some discomfort because of this lack of estrogen actually causes the opening to the vagina to kind of contract a little bit. And the less sexual activity there is, and the less hormone production and supplementation that there is, the more that it contracts, the more pain, the less intercourse. And these can be really tough problems for women. So among the things that we do, we try to look at the root cause. What's really going on? Is there a hormone deficiency? Is there a structural deficiency? Is the lack of sexual response because the woman loses urine when she's having intercourse, or because she's having pain? If it hurts when you do something, you kind of want to quit doing it. And a lot of us guys, we're like, come on now, let's enjoy this relationship. And too often I see women who are they're kind of like, passive recipients and gritting their teeth just to try to maintain their relationship and keep their partners happy. Well, that's not a very good existence. And so among the things that we do in our practice, we look at the hormone milieu, if you will, or the environment, and we restore the various hormone deficiencies that might be causing some of the trouble. And then there's a pretty cool thing that we do in our practice through the Cellular Medicine Association, a technique developed by a remarkable physician from Fairhope, Alabama, named Charles Runnels, about 8 years ago, called the O shot, or the orgasmic shot, or orgasm shot. And what he discovered was that you could take your body's own healing tissues and reintroduce them into critical areas and recover and restore the functionality of those areas. So he knew that this product, and it's called PRP or platelet-rich plasma, had been used in orthopedics to help restore the function of the knees and the hips and other joints. And so he wondered, could this possibly help women restore or regain functionality of the reproductive tract? Well, imagine, if you will, if you got a pinprick in the palm of your hand, and you look down there and there's a little drop of blood. Well, let's use even a better example. Let's say you got a cut on your hand, and that cut bled for a little bit, and then the blood coagulates, and then a scab forms, and then the scab eventually sloughs off, and when it sloughs off, by golly, the edges of the skin have glued themselves together. Well, that's because your body has these regenerative properties in the plasma that circulates all the time, everywhere in your body, to help heal those tissues. So what platelet-rich plasma is we take your blood, we put it in a vacutainer, a blood tube that's approved by the FDA, spin it down in an FDA-approved centrifuge, and separate the red blood cells from these regenerative tissues and products that are in the plasma. Then we take that liquid, activate those products with some calcium chloride, and then reintroduce it into the human body. With the reproductive tract, what we do is we use a topical cream so that when we put these regenerative products back into your body, you don't feel it. So we put these regenerative tissues back into the body of the clitoris and underneath the urethra, between the vaginal wall and the urethra, that helps restore urinary continence or the bladder control, and it helps stimulate the G-spot. And it's a remarkable product. It's just like your body's re-healing itself or restoring itself. And those regenerative tissues or the regenerative products that are in the PRP start to work right away. The platelets work over the course of about a week, and then some of these other products then continue to work over a course of 3 or 4 months to improve sensation, lubrication, bladder control, and improve the sexual response. And in fact, by doing all of these maneuvers, it actually helps stimulate libido. And if you use that in conjunction with the maintenance or obtaining optimal hormone therapy, it's a remarkable opportunity for my patients. I'm publishing a couple live interviews with patients who have had this procedure done, and it's like a miracle to them. They've gone from, on a bother index of 0 to 10, 10 being a huge bother or deficiency, down to a 1 or a 2 with a single injection. It's something that we can do in the office. There's no prep. You don't have to shave. You don't have to take a laxative. You don't have to douche. You don't have to fast. You can drive yourself to the office. You can drive yourself home. There's no downtime from work. It's just the 45 minutes or so that you'll be in the office to actually have the procedure done. We're taking blood from you. It's your own blood, treating it, and then reintroducing it into your body. It's a remarkable procedure. It's called an O shot. We do this also for men, called a P shot, and I'll address that in a separate interview. But again, this is done in conjunction with the maintenance of hormone replacement therapy and hormone levels that can actually be transformative in life. It can help restore relationships, save marriages, and you know, I've been doing this a long time. I'm an old guy, and I've been a doctor for almost 40 years, and this is the most energized I've ever been about the practice of medicine. If you think about it, if I prescribe a blood pressure pill, here, Miss Jones, take this blood pressure pill, it's going to help you get your blood pressure under control. I never hear Mrs. Jones come back and say, thank you, doctor, I feel so much better. But this kind of a procedure can absolutely make the difference between a successful and a failed relationship, and self-worth and self-satisfaction that is unlike anything else I've ever done in medicine. So if you'd like to find out more about this, please visit us at www.drbrittain.com. Visit us on Facebook at Vibrant Life, VIBRANTLIFE. Our office number is 812-331-9160. We live in Bloomington, Indiana. If you want to send us a message, that's fine. If you want to share this information with a friend or a colleague who lives somewhere else, and maybe they can find a physician in their area that can help treat them, it's through the Cellular Medicine Association. You can find a list of physicians who can provide this service. So I hope to hear from you soon. Thanks a lot.